Now, a closer look at the news and issues affecting you. The Midday News with Herb Weisbaum on KOMO News 1000, FM 97.7.
Good afternoon. Hope you're having a good Tuesday, and thanks so much for spending part of it with us here on KOMO. I'm now here from 1 to 3 o'clock on the Midday News, digging deeper into the things that really affect your life. For example, there are thousands of people in this state who are primary caregivers for their loved ones. It takes a lot of work. Some of them, it's a full-time job, and it can take a toll on them, and there are not a lot of programs in place to help. The state Senate just passed a bill that's designed to try to change that. It is called the CARE Act, and it now goes to the House for consideration. And I just spoke to Cathy MacCaul, who is the Advocacy Director at AARP Washington. She's in Olympia, about what this CARE Act would do for folks in this state.
The CARE Act will help unpaid family caregivers assist their loved ones when they go into the hospital and as they transition home. The bill features 3 provisions. One is that they designate a caregiver. The second is that the hospital records that caregiver. And then the third is the hospital trains the caregiver upon their loved one's discharge from the hospital.
Will there be a significant cost to the state for this?
What is really terrific about the CARE Act is there is no additional cost to the state. We've worked closely with the Hospital Association, and the hospitals already do a fabulous job in discharging in most cases. And what this bill does is it brings continuity to the discharge planning process across all hospitals in the state.
You did a survey of people across the state to find out what they thought about this and the problems they're having with helping their loved ones, caring for them at home. What did you find?
In Washington state, we have 1.2 million caregivers in the state, and we surveyed a small portion of those folks. And what we found out were caregivers age 45 plus who were caring for a loved one. 94% of them really support requiring hospitals to demonstrate medical tasks to the caregivers. And then an additional 91% supported requiring hospitals to keep caregivers informed of any kind of major decisions. We were really pleased about these results, and it really reflected, again, the importance of the CARE Act bill here in the state of Washington.
So can you give me a specific example of what exactly a hospital would have to do if my loved one is being discharged and they're going to come back to my house?
A lot of people who are caregivers need to learn how to give injections. Often giving an injection, it seems simple, but it's often challenging, and for somebody that's never done that before, it can be really challenging and really cause a lot of stress. There's also people who use inhalers and effectively treating things like COPD or asthma-related respiratory conditions. Oftentimes, people don't know how to use those successfully, and it encourages the caregiver to be confident in their ability to help and support their loved one and prevent costly readmissions either through the emergency room or directly to a hospital.
Will there be any extra charges to people for this training session that takes place before they leave the hospital?
The training is part of the regular discharge planning process, so there would not be any additional costs related to the training as it is part of their regular discharge process. So
you've made it through the Senate. Do you think you'll be successful in the House?
We are thrilled that the CARE Act made it through the Senate. It was a 49-0 vote, which really shows, again, the real need for the CARE Act. We often talk about the fact that if you're not a caregiver now, you could be one in the future, and or you could be the one receiving care. We think that it's going to be very positively received in the House. We've already had a House version of the bill and have received, again, just really positive support for the bill.
So what you're saying is there's a good chance this is going to affect all of us sooner or later.
I think it's just important, for people to remember that if you're not a caregiver now, you will be a caregiver in the future. And if you're not a caregiver, you potentially will be somebody receiving care. And we feel like this is a great bill that addresses a challenging situation for a lot of caregivers, and they feel overwhelmed by the responsibility they have to be a caregiver. And sometimes people just think of caregivers as providing transportation and helping buy groceries and going to doctor's appointments. But when a caregiver is asked to, provide medical assistance or wound care, injections, or medication management, we want to make sure that they have a good level of training so that they can do those tasks and help their loved one.
Cathy MacCaul, Advocacy Director at the AARP Washington office here. Once again, this is called the CARE Act, passed the Senate today, now moves to the House.